Welcome to Cut the COVID Crap Part 27. The last remaining COVID countries: Hong Kong, New Zealand, West Australia, and Taiwan. Before talking about those ones, let's go through the weekly statistics published by the UK National Health Security Agency. Page 4, you'll see that 29% of the adult population, based on the blood donors, is not vaccinated. Page 41, 2, and 3, if you add up the entries for the adult population, you'll see that 9% of the new COVID cases are amongst the unvaccinated. So 29% of the adult population is not vaccinated. Only 9% of the unvaccinated of the new cases are amongst the unvaccinated. Emergency care 15%, and the deaths 10% only, down from 11% last week, now 10%. Okay, to the last remaining countries. So let's take a look at New Zealand to start with. They had closed borders for a long time, uh, strict lockdowns, and they have a high vaccination rate, and now they have order of magnitude of 23,000 cases a day. That's roughly 0.5% of the whole population gets COVID every day. So they'll go through it. So no matter what they've done, in the end, everybody will be exposed to COVID. So nothing they can do now. That's it for New Zealand. A couple of more days, maximum a few weeks, and then their population is through it as well. Whether they close the borders now or not, irrelevant. No impact. West Australia is a little bit behind. They got 2,000 cases per day, which is a record number of cases. They just opened their borders 2 days ago. So 2,000 cases of a population of roughly 2.5 million. So that's roughly 0.1%. They'll get to at least 10,000 cases a day in a week's time, and also then the population will go through it. And why they have and Western Australia has an extremely high vaccination rate. Why they still make a difference for um, going to restaurants, vaccinated or like if you're unvaccinated, you cannot go to restaurants. Why? Mystery, because um, everybody will be exposed to it anyway. Like, take a look at Denmark. They opened up everything, no restriction at all. Almost 50% of the population has tested positive already. Um, the the rates are going down now. Last week there was still close to 1% of the population per day that got COVID. Now it's less than 0.5% of the population, so it's going the right direction. And guess what? No big deal with the deaths and hospitalizations. They manage. The vast majority of the deaths is coincidental COVID cases. So the virus is not going to behave differently in different countries. So anybody can learn from places like Denmark, or from England for that matter. In England, it was clear already a month ago or something. The under 12-year-olds, what is it, 8 to 11-year-olds, 71% of that population had antibodies, and there's no excess mortality there. So why bother with children? And you see that in Hong Kong now. Hong Kong has got massive problems now. They had the zero COVID policy as well, and they managed for a long time. And now they got roughly 1% of the population per day gets COVID these days. One of the in the top 10 in the world, at least in terms of death rate. But more importantly, the death rate in Hong Kong is very large. It's the largest in the world currently, and it's larger than the peak of any time most countries. So why is that? Guess what? The older population in Hong Kong is pretty low vaccinated. So it's one of the it's probably the only country in the world where the old population resisted in getting vaccinated. And the old population, those are the ones that are most at risk. So that's what the government gets for um, yeah having mask mandates for everybody, vaccinating children. I mean, if you, it's not complicated. I mean, if you say like everybody needs to wear masks, and then we can have zero COVID. It is, if you look anywhere in the world, it's not realistic. The older and the weaker needs to be protected, and the younger don't need to be protected. Learn from England, with the younger people. There's no evidence that young people cannot cope with COVID. For the older people, though, it's a completely different story. And if you just show those data to the people without making any mandate, like if you just say like it's your choice. Anybody can get vaccinated from even from 5 onward if you want to. You can say and anyone can get vaccinated, and but between 5 and 17-year-olds, there's no excess mortality at all. So we don't recommend it, but if you really insist, you can do it. But for the older population, here are the statistics. If you're going to get the COVID, you have a relatively high chance of getting an outcome that you don't want. That would convince older people to get vaccinated, I think, rather than saying, "Oh, we're going to get zero cases and everybody should get vaccinated and everybody should get masked, indoor or outdoor, doesn't matter." I mean, it's so simple. It's so simple. I mean, just be realistic, and by hiding stuff and generalizing stuff, um, people are going to be skeptical. And now, and you'll see that. I bet the Hong Kong death rate will still. It's still not. We still have not seen the peak. We'll probably see that in the next week or so. And the whole population is going to go through anyway. They're going to test the whole population 3 times in March. So what use does it have? Then probably, I don't know, 30% of the whole population will have tested positive by then. And then what are you gonna do? Put them all in hospital, like the policy they had before? It's it's disaster, that policy. Anyway, what other countries? Yeah, the only country that is still that still has to go through the COVID experience is Taiwan. They still have Taiwan has a population of close to 25 million, I believe, and they still have only like 50 cases per day, a very small proportion. There's uh, restrictions on getting into Taiwan and needing to self isolate, similar to what Western Australia had. So at some point, Taiwan is going to go through it as well. We'll see. We'll see in what way. But yeah, so Hong Kong, New Zealand, and Western Australia, they've reached the point of no return already. So anyway, yeah, and the once more about the messages of the government. Remember that they said even before the vaccinations were there, vaccination is the only solution. What about natural immunity? And guess where we are now? Natural immunity is way better than vaccination. Doesn't mean that you should not get vaccination. I mean, if you're old and vulnerable, then um, uh, it's a justifiable option. I would say, but the only solution, yeah, it makes people skeptical, of course. And before vaccinations were there, um, no focus at all on existing medicine. Yeah, strange. If health is important, then that should not be your message. And if that is your message, people are going to be skeptical, and the people at risk are going to make the wrong decision. And, especially in Australia, it's a pandemic of the unvaccinated. Really? Look at the data in England. If anything, it's a pandemic of the vaccinated. I mean, I don't support that statement. I mean, it's uh, it's a pandemic, and the people that have natural protection have the best chance of not getting it anymore. And 97% of the people that are unvaccinated have had COVID already. That's why they don't take it and take the vaccination. And why should they? Lastly, you can't have any YouTube video without talking about Ukraine or Russia. I don't support any war, including the invasion of Russia and the Ukraine. But why do we need to punish Russian people worldwide? I don't understand that. I mean, yeah, I can agree that Putin is an idiot, and that he should receive some sort of pushback. But why can't Russian sporters do what they do their profession? Why can't they play football matches against other countries? I don't get that. I mean, I think Trudeau is an idiot as well. But yeah, why would we? Because Trudeau is an idiot. Why should we disrespect and block Canadians? I support Canadians for what they've done. The truckers are heroes. They behaved very well, and their bank accounts being frozen and stuff. Ridiculous. That's why I think Trudeau is ridiculous, and he should be gone after. But that's no reason to discredit Canadians in general and make a comparison to the U.S. invasion of Iraq. I'm not talking about the first one where they defended Kuwait. I mean, there's a point to make there. But the second invasion of Iraq, where they said there were weapons of mass destruction, which were not there. They admitted after a few years. So what did we do then? The US invaded Iraq for phony reasons. Did we block US people from entering abroad, or did we confiscate their the risk the rich US people confiscate their boats, or did we not allow sports people to have international matches? What's the difference there? I mean, a country invading another country is no good, but generalizing then and punishing anyone from that country, I don't see any reason for that. And if there is a reason, why didn't we do that with the US in the 90s? Again, I don't support Putin. I don't support him or anyone invading a country, but yeah, the punishment should be on the leader and not generalizing on like it's ridiculous. Go after Trudeau, but yeah, we don't go after the Canadians, do we? Anyway, that's it for this week. See you next week.